Bismillahirrahmanirrahim. In the name of Allah, the most beneficent and merciful, I seek refuge of Almighty from problems, tensions, sufferings, rumors, blames, and all the disastrous things that afflict us badly. I seek refuge of Almighty from the things that He created and we created. Allah is kind and sophisticated, manageable and incomplete. We have started this lesson in the name of Allah. There will be guidance, mercy, and knowledge from Him to us. My name is Aishaini. I'm going to present my topic of presentation on Indus Hospital Network. So, if we talk about the beginning, how they started the INH, the Indus Hospital Network. It says that the founder of the Indus Hospital, Dr. Abdul Bari Khan, a group of professionals with the support of some philanthropists and businessmen, served in the public sector hospital for many years. During their time at government-run hospital, they witnessed the plight of COVID-stricken patients of Karachi. So after a few years, in the year 2005, the Islamic Mission Trust donated a non-functioning hospital building to our founders. This building was renovated and made operational in the year 2007. So basically, it was established in 2007, and Indus Hospital was set up as a tertiary care multidisciplinary hospital with 150 beds in the area of Karachi. And the Indus Hospital is basically a tertiary care hospital and health system in Pakistan. And it is located in the heart of Karachi, one of the densely populated area in Karachi, with population of around almost 18 million, right? So the INH is not for-profit healthcare system, which solely relies on public donations. The primary finding comes from the individual in the form of zakat, while the remaining amount comes from corporate donations and the local international grants. After establishing a resource generation network in the Pakistan, INH has developed an out-of-Pakistan system to generate more resources. And if we talk about the unique feature of the hospital, that it is privately run, but offers services completely free of charge. And the idea of a free public hospital was conceived by four medical students after they visited the 1987 Boria Bazaar bomb blast site, and they experienced much frustration in the limited capacity of nearby civil hospital, Karachi's emergency ward. Their dream came true nearly exactly after 20 years later, when the Indus Hospital was established in 2007. So, if we continue with it, the Indus Hospital has now evolved into health network with hospitals, public health outreach clinics spread all across Pakistan, serving undeserved population of Pakistan with free of charge, indiscriminate, and quality treatment. And this is the building showing the starting of the hospital building, and this is the building here. And if we talk about the staff, it includes Dr. Abdul Bari Khan, who is co-founder and current CEO of Indus Hospital, Dr. Zafar Zaidi, Siddiq Sheikh, chairman in 2015 Indus Hospital. Next is said that Indus Hospital is currently managing 12 hospitals in Sindh and Punjab, 4 physical rehabilitation centers, 4 regional blood centers, Pakistan, one of the largest pediatric oncology units, primary care centers, and a large number of public health initiatives in 52 districts across Pakistan. And if we further expand its services, it also let us know that increasing volume of patients, the current Karachi campus in Karachi is being expanded from 300 bed facility to 1,000 bed state-of-the-art facility. And with this, a new 600-bed tertiary care hospital is also being constructed in Lahore. And the Indus Hospital on QF and NST campus. Both hospitals would have medical colleges and schools of nursing and midwifery. Next, it says that NIH is collaborating with several international non-governmental agencies and healthcare organizations to reach out to more people. And it has 5 international branches to tap into potential of Pakistani diaspora in the USA, UK, Canada, Australia, and UAE. This is a map showing the branches of INH in the different sides of Pakistan in the form of hospitals, rehabilitation centers, public health initiative sites, regional blood centers, and primary care clinics. So, yeah, it shows here different sides of Pakistan, and it is mentioned with red, blue, yellow, green, and blue marks, red dots. Next, if we talk about the facilities that it provides to the Pakistan services, the hospital itself serves mainly the adjoining areas of Karachi and Landi with a population of 2.5 million in its 5-kilometer radius. But it also receives patients from the rest of Karachi, and the phase 1 of this 5 billion rupee project has been completed and made functional with 150 beds in modern patients coming accommodation. And in 2014, Indus Hospital reached 1,500 patients every day for free. And presently, the services that are being afforded in outpatient or inpatient categories include nephrology, urology, cardiology, cardiac surgery, general medicine, general surgery, orthopedics, ENT, infectious diseases, pain management. The hospital is well equipped with an angiography suite, dialysis unit, lithotripsy suite, advanced interventional radiology setup, molecular lab, and biosafety laboratory, tuberculosis lab, besides the conventional necessities of tertiary care hospital. And the hospital is run and funded by philanthropic foundation. Indus Hospital mainly operates, as we already discussed, on donations. And it operates mainly on donations from friends and supporters of its services. It provides free treatment, including some medicine. And it is one of the hospital, first paperless hospital in Pakistan, and it is the first ever paperless hospital established in Pakistan with a very user-friendly hospital management information system that was developed in-house. So all the medical records, including history, examination, investigation, radiological images, reports, electroradiography, dialysis session, operative notes, nursing records, like fluid balance charting and vital signs monitoring, etc., are recorded directly on the computer with no element of hard copies. And e-cardiology at the Indus Hospital uses text, multimedia, messages to transfer information. Indus Hospital aspires to expand to 1,500 bed hospital over 21 acres of land, as we already discussed. And free artificial limbs facility launched in March 2015, a state-of-the-art rehabilitation center for handicapped people was launched, and this facility was with the help of international community of Red Cross and Charles. So the center is already working in collaboration with the international universities and is quite capable of executing community outreach programs and precisely analyzing the gathered data. And it is also equipped with video conferences facility enabling direct communication with universities and the different centers, different research centers worldwide, all across the world. So there was a foundation known as Walk Foundation between 2000 to 2500 artificial limbs will be manufactured and it was the mission and fitted to patients free of cost every year. The hospital will also counsel and train disabled persons and hospital has a research center with its own field workers along a core team of epidemiologists and biostatisticians. So through this program, 45,000 online books and 23,000 journals are available to critical faculty, researchers, and trainees at the Indus Hospital. If we talk about the international chapters, it says that as it is a non-governmental hospital and it is totally privately run, and um, it has its relation with the uh, hospital and public health outreach clinics spread all across Pakistan and internationally and nationally. So India's health network is a self-sustaining system which solely relies on public donations, as we already discussed, and the primary funding comes from Pakistan national side residing in and outside the country. And the creation and existence of the Indus Hospital shows the generosity of the individual and corporate donors. After establishing a resource generation network in Pakistan, INH has developed an out of Pakistan system to produce more finances. So, if we see Friends of Indus Hospital, USA chapter, or the Friends of Indus Hospital, the Friends of Indus Hospital US chapter says that it is 501c tax exempt charity established to support the Indus Hospital, which means that the particular non-profit organization has been approved by the Internal Revenue Services as a tax exempt or charitable organization. Charitable, or we can say religious, educational, scientific, literary, testing for public safety, and one of the biggest benefit of 501c3 is exemption from taxes, and this means that the organization is exempt from federal taxes, sales taxes, and property taxes, whatever. And you may even be exempt from payroll taxes if you have employees or staff like that. And one of the disadvantages of non-profit state is limited purposes, like in order to be exempted under the tax laws, a non-profit organization can only perform certain functions listed in those laws. And lobbying, which means that most types of tax exempt non-profit organizations are forbidden from contributing to political campaigns and may only do a limited amount of lobbying. So public security is another factor which says about the disadvantages of non-profit state, and and the benefit is that a non-profit organization work for the public good rather than for a profit like private businesses. Non-profits enjoy the business of tax exempt states and the protection of directors, officers, and members from personal liability. So the Friends of the Indus Hospital is driven by so it says that they are driven by a highly passionate and successful group of professionals who have a wealth of medical knowledge and fundraising experience at hand. So here are some missions, or we can say objectives of INS. Number one is to focus on creating an excellent driven, comprehensive, compassionate, free of charge, and replicable healthcare system accessible to all, which is one of the factor of primary healthcare system. to be, and second one is to be a non-profit entity managed with the Islamic concept of work and funded through donations and zakat. Third one is to adhere to ethical best practices in all aspects of its operations while following the Sharia and the law of land law. And the fourth one says that to empower the employees for their spiritual and professional growth. And last one is to enhance and build human capacity through quality education and research. Here are some stories. If we look for the stories of INET, it just demonstrates that success is measured by patient satisfaction with services and care they receive when visiting the hospitals. So view the inspirational stories of patients while they're in this hospital experience and stories of staff, how they are dedicated to selflessly serve humanity. And this is how it works for the patients all over the world. That's all for my presentation. Thank you so much.